So, the question now, can we further specify ang lung lesion other than lobe? Yes, the answer is yes, no? Ay, hindi ko na kamo makita. Participants. Okay. Sige. So basically, other than lobar, so let's say we have a mass lesion here. Then you want to know ang specific nga site because gusto nyo malantaw kung sa chest x-ray palang accessible siya for a biopsy, ang mass lesion. Okay. I guess you know this, that other than the lobes, no, the lungs are also divided into segments, di ba? So for the right lung, we have 3 lobes, and these 3 lobes are further divided into 10 segments. For the segments sa right lobe, ang right upper lobe is actually divided into 3 lobes, 3 segments, no? The apical, posterior, and anterior segment. Your middle lobe is actually divided into your lateral and medial, while your right lower lobe is divided into your anterior, lateral, posterior, basilar, and anterior, that would be anterior basilar, lateral basilar, posterior basilar, and your medial basilar. So all in all, sa right lobe nyo, you have, your right lung have 3 lobes and 10 segments. On the other hand, ang inyong left lung naman actually, it's just divided into 2 lobes, di ba? Because your middle lobe now is now incorporated sa inyo ng left upper lung, and that actually is part of the segment na sang left upper lung, which you call the lingula. Okay. So your left upper lobe is divided into 2 lobes and further divided into 8 segments. The 8 segments are your apico-posterior segment and anterior segment for the left upper lobe. Meaning, ang natabo dire, kung sa right upper lobe nyo, may apical, posterior, and anterior kamo, sa left upper lobe nyo, duwa na lang yung segments. Kaya ang apico-posterior nyo was incorporated or isa na lang, so that's why nga 2 segments na lang. Your lingula now, the first mention actually sa middle lobe that you have, di ba sa middle lobe nyo, you have your medial and lateral. Sa lingula nyo naman niya, you have your superior and inferior lingula. For the lower lobe, ang nag-merge naman here actually is your anterior and medial basilar segment. So you have still your posterior, you still have your lateral, and you still have your superior segment, and mula na nag-merge lang anterior medial basilar. So for short, right lung 3 lobes, 10 segments, left lung 2 lobes, 8 segments. Tandaan nyo na, kay basi magwa na siya sa inyong board exam. Ang reason nga nag 8 segments na lang because ang sa upper lobe sang left upper lobe nag-merge ang inyong apico-posterior, while sa lower lobe sang left nyo, instead nga may anterior kag medial kamo, nag-merge into anterior medial basilar segment. Okay. Now, with that, actually, if you just do again a lateral view, you would be able to delineate if what segment actually, in particular, the lesion is located. So in this case, if you notice, you have an opacity, a wedge-shaped opacity at the right perihilar area. On the other hand, if you do a lateral view, you have an opacity here at the posterior portion of the lungs, most likely beneath your major fissure, but way above compared to your basilar. So, most likely, ma-deduce nyo nga ang lesion nga ini would be found sa right lower lobe pneumonia nyo, in particularly involving your superior segment. Kay ang inyong lower lobe actually, ang iyang position would be at this point. So, this is just to show you nga pwede ta actually maka-diagnose sang we can actually identify in what particular segment na involved if we're going to do a how we localize lesions not only by lobe but by segment. Carm, mabatian niyo pa ko? Okay pa ta?
Yes, Doc. Okay,
Okay,
pa,
sige. I'll just proceed ha. So we're now going to proceed na sa pleural spaces. So pag breathing gani, two components, we have the lungs and the pleural spaces, no? So for the pleural spaces, basically, di ba, as you well know, ang aton nga lung parenchyma basically is enveloped by pleura. So the closest ang naga-directly envelope sa aton nga lung parenchyma, we call it visceral pleura, di ba? Between this visceral, pero ang aton nga pleura in fact is made up of two sheets, di ba? We have the inner one which wraps the parenchyma and we call it visceral pleura. Then there's a potential space actually between that visceral pleura and the outer layer of your pleura, which is parietal pleura. Ang inyo naman niya nga parietal pleura, amo naman ni siya ang sa makita nyo sa inner portion sang inyong thoracic cage, di ba? So they're basically lining your muscles, intercostal muscles and your ribs, no? So sa ano na siya nang makita mo na siya sa inner walls ng thoracic cage. So anong significance ng inyong pleural space? Okay. There are actually quite a number of conditions wherein the pathology is within the potential space created between the visceral pleura and parietal pleura, and this potential space is what we call now the parietal the pleural space, no? So this is actually your parenchyma. This is your lung parenchyma. If you notice, your lung parenchyma is enveloped by your visceral pleura, the green one. And on the other hand, the inner portion of your thoracic cage is lined by your parietal pleura. In between, the black part, in between the visceral and parietal, you have a space which we call the pleural space. So this actually corresponds to your right costophrenic angle. This one corresponds to your left costophrenic angle. This one is actually an image of a sagittal image of your thoracic cage. And if you notice, you have a potential space here, which actually corresponds to your posterior costophrenic angle. And this one actually corresponds to your anterior costophrenic angle. So, as I've said, we have to discuss the pleura and pleural space because there are quite a number of common conditions which are located within your pleural space. And one of which is very common is antortosa. Antortosa.
Yes, doctor.
And can you describe what's the abnormality here? Is it an opacity or lucency?
Opacity, doctor.
Opacity. Good, very good. So sa left basal lung or sa left lower lung, there is an opacity which is actually meniscal forming, no? Though meniscus ni siya, no? And it is quite a homogeneous opacity. So kung opacity siya, most likely it is made up of what components ng body or ano siya nga substance ang ginadudahan ta kung opacity gani? Kung
What?
sa densities. Yeah,
What?
water or kaya ang opacity, di ba, usually it's either soft tissue or water. Kung amonika kasiri, no? So actually this one is made up of water. So this is not actually involving directly your lungs. So hindi ni siya nga ang lungs nyo may fluid, but it's actually nga ang natabo dire what do you call that? There's fluid actually within your pleural space. That's why your lungs is collapsed, and the haziness here at the mid portion of your left lung actually corresponds to the partial or passive collapse of the lungs as it as the water pushes it superiorly. So ang natabo, you actually have a pleural effusion. Sa clinical practice nyo sa uli, how would you know if it's pneumonia? How would you know if it's pleural effusion? Actually, kung pleural effusion siya, more homogeneous, kag medyo white siya katama as compared sa pneumonia. Then on top of that, actually, it's more confluent. And this one is a giveaway. Ang meniscus nga forming, no? Nga opacity. This one actually, the haziness here actually does not necessarily mean pneumonia. Pwede ni siya nag-hazy ni siya because you have moderate pleural effusion which pushed and passively collapsed your adjacent nga, probably this one actually corresponds to your left lower lobe nga lang. That's why nag-hazy siya. So this is pleural effusion. Next. Celine Canlas. Celine Canlas.
Doc, good evening.
Good evening. Can you identify the abnormality here? Is the problem lucency or opacity?
More of lucency, Doc, sa
Yeah.
may arrow.
Yeah, actually, it's just not the arrow. If you notice, this area is lucent. Notice nyo?
Yes.
This whole area is lucent at you cannot see any, or it is devoid of pulmonary vascular markings. So this one are the pulmonary vascular markings, no? Mga branching ni siyang opacities, linear opacities, represent actually your pulmonary vessels. If you notice, there's a lucency here without pulmonary vessels. And actually, if you notice, medyo hazy na di ang inyong alang parenchyma. So what do you think happened here, Celine? What produces your lucent nga lesions or density sa chest x-ray? Basically, duwa lang na siya eh. Usually, kung lucent sa chest x-ray. Ano na siya nga densities gani?
Air, Doc.
Air and
fat.
good. So it's air and fat. But in this case, least likely nga fat siya.
Air.
So most likely it's air. So what do you call that condition wherein you have air sa pleural space?
Maybe pneumothorax, Doc.
Very good. So you call it pneumothorax, no? How would you know that this is the pleural space? Basically, actually, if you notice, this is your lungs. Your lungs is partially collapsed. It's partially atelectatic. That's why it has an the opacity is increased. And if you notice, this is the viscera. Okay, and this one is your parietal pleura, ideally. So if you notice, the air is between your viscera and your parietal pleura. So the air is occupying your pleural space, and this is actually a classic case of pneumothorax. Very good. Espiritu Christine Joy. Espiritu Christine Joy. Is Christine Joy around? Good evening. Daw, choppy. Yun ang line mo, no? Okay ka lang? Kabati ka lang? Okay ka lang? Okay. Sige na lang. Save by the connection. Medyo law ay gigurong connection mo. Okay ka na? Okay ka na? Okay. Can you describe the abnormality in this case? Christine, i-hold ta na lang ka ha, kay medyo laway, giguro ang line mo. Koki Sato. Koki Sato.
Here, Doc.
Alaw ay gitin. Sige na lang, Tin. Okay na lang, hindi na lang. Do we have Koki Sato around?
Yes, Doc. Good evening.
Good evening. Okay, that's clearer. Can you identify the problem here? What do we have here?
I do see some opacity around the middle, around the mid, around the middle lobe.
That would be right or left?
I think it's on the both sides.
Is it
Both sides in the middle?
Okay, what else do you see?
Other than the right, on the right X-ray, I do see some. I do see some. The positives that is scattered apparently. Not really sure.
Okay. First, let us orient ourselves. So this one is your right lung, okay? This one is your left lung, okay? Which do you think has a problem? Your right or your left lung? The right hemithorax, is it normal? Or do you see any problem there at the right lung? Actually, when you read X-ray, the first thing to memorize would be the normal findings. So would you consider the right lung as normal, or is there some sort of abnormality that you have seen at the right lung? Koki? What? I'm sorry. Yeah, Koki Sato.
Yes, no.
Can you see the right lung?
Yes, no.
Is there some sort of abnormality there, or do you think it's normal?
I guess the right side is more opaque than the left side.
Okay, let me help you. The right lung is actually normal. I do understand that it's really quite difficult for you to discern at this moment whether it's normal or not, but you take my word for it. The right side is normal. This hilum, this opacity here is actually normal, and it's because of the vessels, primarily the pulmonary vessels. On the other hand, these branching opacities, which you see, linear opacities, are pulmonary vascular markings which are normal. The abnormality here is actually at the left lung. Probably Maranyon Kevin, could I help us identify what's wrong with the left lung? What's wrong sa left lung? Maranyon Kevin. Kevin Maranyon, is he around?
It looks like there is
Yeah.
tissue in the left lung growing.
Come again?
It looks like there is tissue growing in the left lung or fluid.
Okay. There's fluid at the left hemithorax, particularly what portion, the lower portion or upper portion?
The lower portion, doc.
Okay. So this one actually, if you notice, there's a leveled heterogeneous opacity at this point, which is quite abnormal. If you notice, you cannot delineate your left hemidiaphragm at this point. So this one actually, usually, and most likely corresponds to fluid. So this is a case wherein you have pleural effusion at the left lower lung. For a while, Dr. Dumagit is calling. Yes, Doc? Hello, Doc? For a while, ah. Can you hear me? Okay lang ta. Can you hear me? Carm?
Yes,
Carm, can you? Okay, okay. So this one actually, you have fluid in your left hemithorax. And if you notice, there's some degree of lucency at the lateral aspect of your hemithorax. And this one actually corresponds to the viscera. So this one actually is your partially collapsed lung. That's why compared to this one, which is more lucent, medyo hazy ang inyong left lung because of atelectasis or partial collapse secondary to the pneumothorax or air in your pleural space occupying the mid and upper portion of your hemithorax. On the other hand, on the lower portion of the hemithorax, you have fluid here. So this is actually a case of pneumohydrothorax. So it's a combination of pneumothorax or air and hydrothorax or fluid in your pleural space. So I just actually would like to introduce to you some diagnoses that are some conditions that you can diagnose with almost certainty using X-ray images. Okay, so that goes for our airway. We will now proceed with our airway. I will end my lecture after I finish this one, the airway, para at least I know medyo kapoy na kamo siguro. But anyway, talking about airways, basically we have the trachea as our main structure when we talk about airways. So our trachea actually has has two portions. One would be your cervical and your thoracic. So sa x-ray nga chest x-ray, most often what you see actually is your thoracic part of the trachea. This trachea now is divided actually inferiorly into two main tubes. So the branches would be your right main bronchus, and the other one on the left, you have your left main bronchus. Your bronchus actually is further divided into segmental bronchi. And this one basically supplies the various segments which we talk about. So for the right, you have 8 segmental, for the right, you have 10 segmental bronchi. On the left, you have basically 8 segmental bronchi. So this one actually just shows you the superimposition of the structures, highlighting your trachea. It's really quite difficult to find an X-ray which have a well-delineated trachea, but as you well know, when we talk about trachea, what's inside it is air. Therefore, basically, it is more of a lucent structure. So this one is actually your trachea. And if you notice, it's branching inferiorly into your right main bronchus, your left main bronchus. The angle here actually is what we call carina. Carina is something that we also usually quite use often, because actually the carina, especially this point, the pointed tip of the carina, it is where you start measuring whether the endotracheal tube of the patient is in place or not. Nevertheless, as to the difference of the right main bronchus and to the left main bronchus, please take note. Anyway, that's the trachea, right main bronchus, left main bronchus, and the carina. So please take note that one of the difference between your right main bronchus and the left would be that your right is wider. Your right, however, is shorter, but it courses more vertically. So it is wider than your left. It is shorter than your left. and it traverses more vertically compared sa left nyo. So more obtuse ang angulation sa left as compared sa right, no? So actually, ang right main bronchus nyo lies inferolateral and posterior to your right pulmonary artery. So we call it hypoarterial. On the other hand, your left main bronchus basically lies alongside your left main pulmonary artery, and we call it epiarterial. Nevertheless, this is just to show you the significance of your airway. Your airway can give you an idea of what condition. Okay, if you notice, the problem with chest X-ray is that some entities or some disease entities just look the same. So in this case, you have an opacity here. What do you think is the problem here? Diba, when we talk about opacity, we talk about atelectasis, or we talk about a mass lesion, or we talk about, we're referring to a pneumonia or fluid. Miguel Karam, would you have an idea what's the problem in this case?
Hi, Doc. The trachea is
Yes.
shifted to the right. Is that it?
Yeah, deviated to the right. And what's the problem here? Is it opacity or lucency?
Opacity of the lung, but lucency of the trachea. I'm not sure.
No, the trachea is actually normally normally lucent. And
Alright.
yeah, you're right. The problem is that the trachea is deviated to the right when it should be at the midline. And if you notice, there's elevation at a certain degree of your right main bronchus. Okay. Then the problem here is we have your right lung or right hemithorax is basically completely, we actually call this white out. So basically, you find an opacity which encompasses almost your entire right hemithorax. What do you think is the problem here? What are other problems that you can see here other than the tracheal deviation to the right and the opacity at the right hemithorax? Can anyone help? But at least, good points. Nicole Alejandro, what do you think actually is, can you point out any problem with this image, Nicole?
Evening, Doc.
Good evening. If you notice, Nicole, the white arrow is pointing at something. What do you think is the problem there? Can you point out where the heart
Doc,
is?
fluid, Doc.
If this is fluid, actually, the trachea wouldn't be in such orientation. I am showing you this image just to show, also just to show you the importance of the appearance of your airway, as it will help you clinch the diagnosis. Actually, this is quite a difficult case if you're new to radiology, but if you notice, it's not only your trachea which is deviated to the right. There's also ipsilateral shifting of your mediastinal structures, such that the arrow is just pointing to you that the left cardiac border is almost already at the parasagittal or paraspinal portion, at your left paraspinal portion, meaning your heart and the other mediastinal structures are shifted to the right already, adding to the opacity of the right lung. So what do you think caused the shifting of your trachea to the right and the shifting of your trachea to the right? Ortiz Sophia, what do you think happened here? Sophia Ortiz, good evening. What happened here?
I'm
What
not
do you
sure,
think?
Doc, pero ang lung,
Yeah.
Doc.
Yes, yes. I'm sorry, I cannot hear.
I'm not sure, Doc,
you-
pero nag-collapse ang right lung.
Correct. Actually, the right lung collapse. That's why the mediastinal structures, including your trachea and including your heart, shifted to the right side, shifted to the side where the lungs collapse. And what do you call that condition wherein you have a collapsed lung? What do you call that condition? Sang collapse nga lang. I've been mentioning that. Can anybody help? Ralph Reyes, what do you call that condition wherein you have a collapsed lung or decreased volume, lung volume? Ralph Reyes.
Hello, Doc.
Yes, What do you call that condition?
Atelectasis, Doc.
Very good. So actually, this one, the problem here is that you have your right you have a right lung atelectasis causing the opacity. Adding to the opacity would be the mediastinal structures which are shifted to the right. So this is just to show you that not all white are fluid. So this is not actually, you would be able, okay, we'll just proceed with the, very good. We'll just proceed with, I'm sorry. I don't have it. Okay, anyway. So this is just actually just to show you that not all white are fluid. So some white can be due to pneumonia, as I've shown you sa COVID, sa case ng COVID pneumonia. Some white also can be due to, what do you call that? Have I mentioned atelectasis, no? On the other hand, it could be due to the shifting of your mediastinal structures, which are primarily composed of fluid or soft tissue na components, fluid blood, okay? So this is a case actually of right lung atelectasis, and this is not actually a case of pleural effusion. So your airway actually here, just to highlight your airway would help you in the diagnosis. Given you have a condition such as this, wherein you're torn between a pleural effusion or a left lung atelectasis. If you have a mass lesion, most likely the trachea will be deviated contralaterally or to the left, because the mass lesion here will be pushing your trachea and mediastinal to the left. If you have fluid, most likely the trachea will be deviated to the left rather than to the right. So there will be contralateral deviation because the fluid will be pushing your trachea to the other side, as well as the rest of the mediastinal structures. So that's basically how we analyze. We look at the opacity or lucency. We also assess the features or the abnormalities in the adjacent structures for us to know actually or to come up with a diagnosis. I will be ending my lecture here. For next meeting, we're going to talk about the cardiomediastinum, and we're going to talk about the rest of the ABCs. So actually I have this is all prepared, but I think too much na siguro, overload na taguro. Would you like to proceed or that's enough for the day na? Carmine?
Everyone's hungry na also, Doc.
Okay, sige. I'm also hungry actually. So we'll just proceed. 5:30 to 7, you bring snacks na. Kay base 5:30 to 7:30 worst scenario makatapos siguro 8 o'clock. But for the meantime, may naintindihan man ka mo, may nakuha ka mo, because I would like to make a revision of my lecture if medyo daw nabudlayan